Now, we kick off with what is happening across the counties. Counties have been warned to brace for challenging times and heavier burden as the cases of COVID-19 in the grassroots continue to surge. Devolution Cabinet Secretary Eugene Wamalwa says the current pandemic will determine if the move to devolve health services was timely. The development coming as the national and county governments enhanced efforts to mitigate the adverse effects of the pandemic across the counties. Beatrice Getich gives us the details.
Concern over the surge in new COVID-19 infection across the country remain rife as the pandemic continues to devastate the globe, with scientists and governments struggling to find a vaccine for the virus. Speaking in Naivasha after attending an Intergovernmental Relations Technical Committee meeting, Devolution Cabinet Secretary Eugene Wamalwa called on counties to brace for challenging times as infection numbers continue to rise. Wamalwa saying that since the partial lockdown in some regions was lifted, hundreds of people have migrated from urban centers to their rural homes, a move that would stretch services in respective to health centers. Wamalwa noting that the government and partners had already released over 13 billion shillings to counties towards increasing their beds capacity in isolation wards.
So we are hoping the counties would utilize that money prudently to build their capacity to improve health services. We're also, through the Ministry of Health, able to release another 3 billion, almost 2.8 billion of which is going directly to the counties. And this should also help the counties.
In the meantime, health workers attending to COVID-19 patients in Kilifi County have decried what they say are painful experiences of being stigmatized for handling victims of the deadly pandemic since it was reported in the country. The health workers who have been and are still risking their lives to handle those who have tested positive claim their sacrifice is costing them both at workplace and in the society, as people fearing interacting with them due to the nature of their job.
Kwa hivyo stigma iko na inatisha, kwa sababu ukiona wale watu unafanya nao kazi wanajitenga na wewe, na huu ni ugonjwa uko na hawa wagonjwa ni wetu, ni lazima tuwahudumie.
And we feel now it is most important given the fact that there has been the lifting of cessation. We feel we need to mobilize quickly and counter that, because freedom comes with responsibility. So we need to really mobilize and hit the ground running, just reminding and re-emphasizing people that lifting of cessation is not and should not mean that we are through and we have flattened the curve where this pandemic is concerned.
Elsewhere, Thika Town Member of Parliament Patrick Wanaina has raised concern over the fate of private school teachers who are facing uncertain times due to the closure of schools occasioned by the COVID-19 pandemic. The lawmaker calling on the national and county governments to come up with counseling programs for those with mental illness due to the effects of COVID-19.
This corona thing has made these people very, very poor to a level where they cannot even have food to eat. So with these kind of things, people who had their lives going on. So the next thing is they start overthinking and the situation becomes worse to a level where a lot of them are suffering from depression. And these are the people you're saying they need to be taken care of very, very quickly.
An Equity Bank Foundation has donated personal protective equipment to 3 hospitals in Kiambu County, geared towards containing the spread of COVID-19. Speaking during the handing over of the PPEs to Kiambu Governor, Equity Bank CEO James Mwangi alluded that the donation is to help the medics protect themselves as they intensify the fight against the contagion.
We think we'll have enough resources to be able to support you for the next 18 months if you prudently use the PPEs. So I want to lead an appeal to you for prudent usage and concentrate as the stock levels come down. Please reorder.
Kiambu Governor James Nyoro appealed to the government to increase its funding to counties to help the demonstration enhance their capacity. Nyoro says Tigoni Level 4, Kiambu Level 5 and Thika Level 5 hospitals will benefit from the donation to combat the pandemic.
We are a county that also is so close to the epicenter, as I said, that we are appealing to the national government, and more particularly the Ministry of Health, to put us together with the other frontline border counties like Busia and Kajiado because of our close proximity to Nairobi.